Yes, good afternoon or good morning. My name is Dr. Boris Mpeeka with this lecture about the anatomy of the oral cavity. When you talk about the anatomy of the oral cavity, we mean when someone opens the mouth, what you see. That is the oral cavity, what a layman can call the mouth. The oral cavity is made up of both hard structures and soft structures. We begin with soft structures. Soft structures, for example, the tongue. The tongue, this is a muscular organ that is found in the oral cavity. In the oral cavity, we shall first look at the tongue. We shall talk about the tongue in the in the videos that will be coming in front there. But for now, the tongue, we shall just talk about it in this overview as a muscular organ in the oral cavity, having papillae in the anterior 2/3 of it, and of course in the posterior 1/3, which is found in the oral pharynx. We do not have any papillae because we do not have mastication taking place. Apart from that, we have the uvula. Uvula, this is the hanging ball at the oral pharynx. It is at the oral pharynx. It is very important because it helps us to prevent choking when you're eating. This is the uvula. Apart from that, we have the palatine tonsils. They are here, very important. We also have the palate. The palate, we can have hard palate and soft palate. The hard palate is towards the lips here, and we have those we have a ragi, which are those foldings. When you look at my model here, these lines here are made by ragi, and ragi are very important, as we shall be seeing in the next videos. We have what we call the frenulum. The frenulum is a line of foldings. We can have a line of foldings that attach the lips, in the oral cavity. We have the upper frenulum, or superior labial frenulum. This is going to attach the upper lip into the alveolar bone, or alveolar bone in the maxilla. We have the labial frenulum of the lower jaw or of the mandible, for it is called inferior labial frenulum. We have the one or the line of foldings which attaches the tongue to the floor of the mouth. That one is called lingual frenulum. And when someone opens the oral cavity, you shall see, when someone opens the tongue, you shall see it just under the tongue in the mandible. Yes, we have now hard structures. The hard structures are the teeth. The teeth are going to be talked about in details, but for now, before we leave this diagram, you can see whatever is here in black. These are what? Are teeth. What do we talk about this one? Before we leave this one, we shall talk about the function of these teeth, or of this oral cavity. The function of the oral cavity, that means the hard structures and the soft structures, all of them, they combine to make a function we are going to talk about. That is the functions of the mouth. Primarily, we are talking about the function is eating. When we talk about eating, we are meaning all processes of mastication that include biting, that include crushing, that include chewing food. All these ones, they are found in mastication or what? Biting. Of course, as the food is broken down in pieces, it is able to be put ingested or put in the GIT or in the in this as proceeds the stomach, so that is ingestion of what? Of food materials. We have chewing food, that one is done. Another function of the tongue, as shall be seen in details in the next videos, we shall see the tongue as a very important function that can easily mix food with saliva. So cyst is found in the oral cavity. It is also given here as a function of what? Of the mouth, mixing food with saliva. Another one is appreciation of taste. Appreciation of taste is found as an importance of the of our mouth, because the tongue has papillae. We shall see different papillae and those that are used to taste what and at what time. We have some papillae which are for tasting sweet, sour, texture. All of those ones are very important. So because of that, we give it as appreciation of food, and maybe we can also add texture. We also have speech. Speech, the mouth is having the teeth and the tongue, and speech is very important because the moment you have speech, speech is made by teeth, muscles of mastication, and the tongue. All of these ones combine to produce words or sounds which are given out in form of phonetics, and someone is able to say certain words, Sara, Mississippi, because of the way how the teeth and the tongue can move to produce sounds in between them. So speech is another function of the mouth. Then we also have social function. Social function, we have smiling. You are able to smile. You are able to smile, and someone is impressed. Someone is impressed that there is what? There is a gesture that is being shown. Then we have kissing as another function of the mouth. From there, we can talk about when a person has closed the mouth. There is what we call, when someone has closed the mouth, there is what we call commensals. Commensals are the corners of the mouth. We shall look at the clinical significance. During angiolitis, we shall have this part being affected. This part being affected during dehydration. The commensals are having cuts, and therefore it can help a clinician know that there is dehydration, there is anemia, there is angiolitis, there is maybe dehydration, depending on how it is done. We have also what we call a vermilion border. A vermilion border, that is the line that makes the end of the lip. So it means we can have the upper vermilion border and lower vermilion border. Vermilion border is for especially ladies as they are applying maybe lip balm. That is where it stops before we join what? The skin. As we also are seeing this picture, as you are going up to the nostrils, we have this one, this depression. We shall call this one a philtrum or cuspid bowel. This one is very important. In the next videos, we shall show the significance, especially when it is affected when someone loses teeth. We shall talk about how it is affected when people lose teeth. Okay, so we talk about teeth. Teeth, these are the hard structures we have been talking about, and these teeth are the ones which we are going to concentrate on in the next videos, because these teeth are very important. Teeth are modified oral structures in the oral cavity. In the next video, we shall talk about what we call primary dentition, permanent dentition, how many they are, and when they erupt. But for now, we are talking about them in an overview, and we are saying they are very important. Mastication. I talked about mastication here, that mastication we are meaning the breakdown of food, the physical breakdown. We can have breakdown due to enzymes. We are not talking about that one now. we are talking about the breakdown, the physical breakdown by food. It means that we can have the physical breakdown that involves biting, cutting, grinding. All of this is mastication, and this is a function of these hardy structures that are called what? Teeth. Aesthetics. Aesthetics is another function of teeth. Aesthetics means beauty. So these teeth are very important. Many people who do not have teeth don't find themselves having self-esteem because they feel they are lacking beauty. Because when you have teeth, you're beautiful, you smile, you feel appreciated. So when someone loses teeth, he loses beauty. Because you can't smile, the teeth are not there. Therefore, someone will feel there's a lack of what? Beauty. We can have people who have whiter teeth, who have bad teeth, dark teeth. When somebody has dark teeth, he will be smiling while hiding. By doing that, he or she knows his beauty is being affected. But when teeth are white, are clean, are not discolored, are in their natural color, it means someone will be knowing I'm beautiful, the teeth are healthy, and they are good, and this is a function of beauty. Speech. Speech, we are talking about phonetics. When teeth, the upper teeth and lower teeth are in the oral cavity, we shall have sounds being produced, what we call phonetics. When people are having teeth not in order, for example, in the next videos, we shall find that some people who do not have teeth, some sounds are not produced. Some people who have teeth again that do not bite on one another, that do not articulate or that do not join. For example, people with open bites, as we shall talk about in the next videos, we shall find that people who don't have teeth very good in their order do not have speech that is organized. So because of that, we shall find teeth are very important. Teeth are very important in what? In speech. To produce words, for example, salam, CCP, all those words are due to the space that is left in between our teeth that is going to help us produce good sounds. We have another one which is maintaining a jaw shape. The teeth are held in the alveolar bone. There is a soft bone that holds the teeth. It is characterized by resorption or reducing in size when you remove teeth. When you remove teeth, the jaw collapses. That is why you find that someone can be 70 years, but because he has never removed any tooth, his jaw looks organized. But another person is 40 years, but because he has lost all his teeth, the jaw collapses and he looks older than 70. So it is good to maintain our teeth, and that is a good a fourth importance of our teeth, what we call jaw shape maintenance. What are these teeth? These teeth, we have teeth, for example, premolars. The premolars, they are also called bicuspids. Bicuspids, they are those teeth. They have two cusps, this one and this one. And these, we shall see them in details. Those are what? Premolars. We have also a cuspid. A cuspid, those are sharp teeth, very important. This is a cuspid, a sharp tooth, very important to make a smiling line of an individual. So a cuspid is called a canine. A canine is very important. We shall see the importance later. We have a molar. Molars are teeth which are also found in the primary dentition and permanent dentition. We shall also find their importance, very important, because these are the majority that are used for especially grinding food, chewing food, very important. We also have incisors. Incisors, these are front teeth, anterior teeth. Anterior teeth, when someone smiles, these are what? teeth which are used for biting. These are teeth which are found in front that make somebody smile. So when we have these incisors, the beauty is increased. Unfortunately, as we continue in the next videos, we shall find that some cultures, they remove these incisors, which is a harmful cultural practice. We shall have a time when we talk about them in details. Yes, so before we go to the clinical significance, we need to mention one more thing that we did not talk about. Of course, it's not in this picture, but it is important because it is helping in digestion. Those are salivary glands. Salivary glands, shall also have a time when we shall have salivary glands talked about, but we have our saliva, which is very important in chewing, in mastication. Food mixed with saliva, it will be able to enter our digestive system. We have a lot of saliva being produced by major salivary glands and minor salivary glands, but we shall majorly talk about how the saliva enters the oral cavity. Saliva enters the oral cavity majorly through two ways, or through two ducts. We have what we call a Stenson's duct. A Stenson's duct, it is an opening just behind the second molar. Behind the second molar is where we have the parotid gland, one of the major glands. It pours saliva into the oral cavity through the Stenson's duct. The second molar that is around here, or around there in the oral cavity. So that is very important. The clinical significance we shall see. We also have the sublingual and submandibular glands. Sublingual and submandibular glands, they are also major glands, and they pour saliva into the oral cavity through what we call Wanthon's duct. The Wanthon's duct is very important because when someone opens the mouth, just under the tongue you shall see saliva or pouring. This one is very important, as we shall see. Then we have the vestibule. The vestibule, that is between the teeth and the cheek, there is that area, the soft tissue. For example, if I tell you this is the cheek, if I tell you see this model of suppose this hand of mine is the cheek, so this area here, this is the vestibule. The vestibule should be kept healthy, and we shall see its significance. So in case you are doing oral examination, we should look for any ulcers in this vestibule, up and down, maxilla and mandibular, in order to check how it is faring. A healthy oral mucosa is pink in color, and that is why you see the model also, maybe they put pink, depending on the rest, can be black, depending on the rest, but as we are checking the oral mucosa, it should be pink in most of the individuals. Then we also have the gum. We shall have a topic, a full slide about the gum. But for now, we know that when the teeth are anchored in the alveolar bone, what is surrounding the teeth here is what is the gum. The gum, we shall talk about the characteristics of the gum, its color, the consistency, the consistency of the gum, the color, how it is stippled, and others. We shall have a topic to talk about that one in details. But for now, we need to talk about the clinical significance of this topic. Why are we so much interested in this topic? As a clinician or as a person who has an oral cavity, we need to know this anatomy of the oral cavity, because in the areas when we have angular cheilitis, for example, the commensals are going to be having cuts. People with malaria, people with dehydration, their commensals are what? affected. It means you need to know the normal before you know the abnormal. We have some people, for example, if you're talking about the tongue, you need to know the normal tongue. You need to know, because sometimes you shall find people having geographical tongues. You need to know the normal tongue before you know the what? The abnormal. We have the Coprix spots. This is what is usually found on the palate as a spot. When people have measles, you can find what? A spot. And the others, which others may be other manifestation of other diseases, can have a chunk of syphilis. You can also find it there. We can have geographical tongue, I've talked about it. Then you can also have some oral manifestation of HIV. For example, if someone has oral thrush, you need to know the normal oral cavity, so that in case someone has oral thrush, you are able to know that this is the normal and this one is not normal, what I'm seeing. Then oral candidiasis, you need to know the normal one, so that in case someone has oral candidiasis, you need to identify it so quickly that I'm dealing with an abnormality of the oral cavity. Thank you for watching. I'm hoping you're going to benefit from this. Most especially, you need to know these normal structures to avoid dealing with abnormality when you do not know them. Thank you so much for watching. See you in the next video.